been provided with an oxygen cylinder as part of your treatment. Your cylinder will contain oxygen that is filled to a high pressure, and cylinders can come in all different shapes and sizes. Static cylinders are designed for use indoors. Due to their size and weight, they are not suitable for use as a portable cylinder. Most patients' experience of this type of cylinder will be as a backup to their oxygen concentrator. It acts as an emergency supply for use in the event of a power cut or concentrator failure. Standard portable cylinders. These cylinders may be carried in a purpose-made bag or wheeled on a trolley, and typically can deliver between 1 and 15 litres of oxygen per minute and enables you to continue your oxygen therapy outside of your home. Lightweight portable cylinders are ideal for children or frail adult patients who find the standard portable cylinder a little too heavy to carry. Oxygen cylinders are very easy to use and very safe as long as you follow the advice provided to you by your home oxygen provider. The main parts of the cylinder consist of a flow selector, on-off hand wheel, protective cover or tamper evidence seal, Schrader outlet, oxygen outlet, a live contents gauge, labelling on the collar and the batch label. Setting up a cylinder. Before you handle the cylinder, make sure that your hands are clean. If you have been using alcohol gel or liquid alcohol to decontaminate your hands, make sure that the alcohol has totally evaporated. Ensure that you check you have the correct medical gas by checking the labelling on the cylinder. Check that the cylinder is in date by checking the expiry label on the cylinder. Before use, ensure that there is enough oxygen in the cylinder for the duration required by looking at the live contents gauge. Ensure that the cylinder is upright when preparing it for use. When setting up or using the cylinder, do not place it on the bed or soft furnishings, as an oxygen leak can lead to oxygen enrichment of the materials, making them vulnerable to ignite. Remove the tamper evidence seal and the outlet cover. Make sure that the flow selector on the top of the cylinder is set to 0 and the hand wheel is turned off before connecting equipment. Whilst using your cylinder, you can attach the tubing from your mask or nasal cannula to the oxygen outlet. Make sure that the tubing is pushed on securely. Slowly turn the hand wheel by rotating it anti-clockwise until it comes to a complete stop, and there is no need to use excessive force. Set the prescribed flow rate using the flow selector and ensure that the correct number is clearly visible in the window. Remember to use the flow rates prescribed by your healthcare professional. Put on the mask or nasal cannula. Remember to check the contents gauge at regular intervals. After use, turn off the cylinder by rotating the hand wheel clockwise until it comes to a stop. Disconnect the equipment by removing the oxygen tubing. Turn the flow selector to 0. Replace the outlet cover. Check the cylinder contents gauge. Return the cylinder to a designated in-use or empty storage area. Some important safety points. Before handling cylinders, ensure your hands are clean. Oxygen cylinders should be stored in a well-ventilated area which is kept clean and dry and away from sources of heat, preferably inside. Do not store or use cylinders near naked flames, sources of ignition or combustible materials. Ensure separation of full and empty cylinders and that labels remain clearly visible at all times. Labels must not be removed or covered, and unauthorised labels must not be fitted to the cylinder. Do not refill the cylinder or attempt to tamper with it. Ensure cylinders are upright when preparing for use. When setting up or using the cylinder, do not place it on the bed or on soft furnishings, as oxygen leaks could lead to oxygen enrichment of those materials, making them vulnerable to ignition. Never use excessive force when opening or closing the cylinder valve, and keep cylinder valves closed when not in use. Empty cylinders must be stored with the valve closed. If a hissing noise is heard, check for the presence of a leak at the connection between the tubing and the outlet. Turn off the cylinder and notify the oxygen provider immediately and isolate that cylinder. In regard to the high-capacity backup cylinder for use in emergency situations, such as a power cut, to ensure sufficient oxygen in an emergency situation, please do not use this cylinder for any other use. When transporting cylinders, ensure they are secured and have good ventilation. Smoking around oxygen is extremely dangerous and may cause clothing, hair and skin to catch fire and burn more vigorously than in air. Never smoke or allow someone else to smoke near you while you are using your oxygen equipment. Make sure that you ventilate your clothing in the open air for at least 20 minutes before smoking or going near an open flame or source of ignition. You should follow these same safety principles with electronic cigarettes. If you suspect that the cylinder is leaking, turn off the cylinder, check the equipment is properly connected. Turn on the cylinder and recheck for leaks by listening for any hissing sounds. No other methods of leak detection should be used. If the leak continues, turn off and quarantine the cylinder in a safe and secure outside area away from the other cylinders and contact the home oxygen supplier. If you have any concerns about using your oxygen cylinder, then contact your home oxygen provider for assistance.